So, without further ado, let me start by introducing the panel. So we'll come to Colin first. If you could say your name, role, where you are in the country, and what the weather's like where you are at the moment.
Thank you very much, Rowena, and good afternoon, stroke evening to everyone. I hope all are well. My name is Colum Conway. I'm the Chief Executive of Social Work England, and my situation currently is in a small box bedroom at the front of my house where my son is normally, but since he's in university, I've taken it over as an office. And it's situated near Newry in Northern Ireland, and the weather right now is really poor, dark and pouring rain.
That's great, thank you. And we'll come to Sharon next.
Hello everyone, I'm Sharon Davidson. I'm the Principal Social Worker for Surrey County Council and the co-chair of the Children and Families Principal Social Work Network. I live in South London and I'm looking out on a lovely, lovely sunny day. Sorry, Callum.
Lovely, thank you. Farah, you're next.
Hi everyone, my name is Farah Khan. I'm the Principal Social Worker in sunny Leeds, although, so I'm sat in the box room of my house, which I've converted into a temporary office, and it's not so sunny today, it's cloudy in Leeds.
Thank you. And finally, Kamlesh.
Hi folks, Kamlesh Patel. I'm Chair of Social Work England, and I'm sitting in a reasonably nice office that we have in the house, though half the furniture's just disappeared because we're moving house. I'm not far away from Farah. I'm in Bradford, and in Yorkshire the weather is always the same. It's good cricket weather. It's miserable, it's cloudy, and it's probably going to rain sometime soon.
That's brilliant. Thanks, Kamlesh. So I'm going to pose the first question that we've had submitted to Colin, which is how can we inspire more people to train as social workers? Felt like a good question to kickstart the future of social work. So how can we inspire more people to train as social workers?
Super, thanks. So at the minute there, we have approximately 4,000 places per annum for social workers across England. And there are, as you will know, increasingly different ways in which people can access training in social work through the degree course and master's courses, fast tracks programs, and now recently developed the apprenticeship programs. And they offer a range of opportunities for people to come into the profession. How can we inspire people? I mean, we've seen that there's been a huge increase in applications to come into the nursing profession, for example, on the back of the pandemic, where the visibility of the work that nurses do and was very high profile across the pandemic, in many ways, in ways that social work to a certain extent wasn't. And I think that's one of the first key challenges. Not everybody in life, in fact, the majority of people in life will not experience social work, will not know what it is that social workers do unless they hear that from a different way. Whereas in many other professions, of course, people experience that profession throughout their life. But social work is slightly different. And in fact, it's interesting to hear about how many people who are inspired to become social workers are inspired by their experience of social work, either directly themselves or within a family context or within their community, or inspired by individual social workers themselves that they know or are connected to. So I think the first key thing for us is to be able to get that message out there in a higher profile way, and to help people understand what it is that social work do, to break that down in a way that people understand that it is highly visible, and the impact that social workers have on people's lives, individuals, families, communities. I think that's key in terms of inspiring people, because there is no doubt that when people do encounter social work, the vast majority of the time they are inspired. There is no question of that. We in our first reflections publication in January asked people about the value of social work and what value they put in social work, the public, and you know, over 80% valued the work that social work did in society. However, social workers themselves, only a quarter of them felt that the public valued what they do. So I think it's also important that we value the profession and lift morale and ensure that there is a strong message about what social work do, its value, and how it can change lives. And people will really warm to that. There's no question of that. And people will respond to that. I think it's really important that social work has the range of opportunities and accessibilities that it has, and even perhaps to broaden that, because I think it's really important that social work is able to reflect the community within which it works in its broadest context. And I think that's really important. So we need to think about how we can look at various parts of society. I think too, there are times when people start off on a particular career and get disillusioned with it in some way and are looking round for other careers that can bring more meaning and depth to their lives. And I think social work can do that as well. So I think we need to look at the age range and at what point in people's lives people can be inspired, because it isn't always just about inspiring the young. It's about inspiring everybody who could come into social work and bring the experience of their lives. And I think we need to build a profession that is profoundly proud of what it does, and it is in many ways, but we're not able to connect that in the way that we should be able to connect it. And I think those are some of the challenges we face. I think as an organisation in Social Work England, we have the opportunity to help coordinate, facilitate and collaborate with others in building that inspiration for social work to come in to the profession, and importantly stay with the profession and build their career there. And I think these are key challenges for us. I read a quote about inspiration there recently that talked about how you spread the light, and it said that there are two ways of spreading light: to be the candle or the mirror that reflects it. And I think the social workers who work across the country, in communities and families across the country, are the candle. And organisations like Social Work England and people like us need to consider how we can be the mirror that accurately reflects and sheds that light in a way that will inspire people to want to become part of the profession. And you know, this is a real live challenge for us at Social Work England, and we're determined to make a difference. And part of that is about building that confidence and bringing the kind of respect and dignity that social work deserves. And that's a challenge for us into the future.
That's great. Thanks, Colin. And that echo will be your mic on. So yeah, brilliant. If you can mute, that'd be great. Thank you. So that's really fantastic. Thanks. So I'm going to take our next question and come to Sharon to ask what issue will be the most challenging for social workers in the next 5 years?
So I'm thinking about it primarily from a children and families perspective, but I suppose I'd like to start off by thinking about the profession. So I think it's helpful, just following on from the points that Colin made, that actually social workers that are motivated to do social work and are supported to do social work across the profession, I think is an ongoing challenge. And I think that recruiting and retaining social workers is something that in 5 years' time, I'm hoping that isn't the challenge that we have now. I think from a children and families perspective, we have the care review has just commenced, so there will be some things that come through that I'm sure that will challenge us, but also maybe taking us in a direction that supports retaining staff. The other challenge that I think is in social work, and I think this probably applies across both the adult and children's perspective is the time to do quality work. So the things that motivate us to become social workers are the things that should help to motivate us to stay and develop our careers, as Colum was describing. So I think that there is a challenge for us to get that balance right, that we need the profession to be recognised, we need the profession to be supported, and the resources that go with that. So we're coming through hopefully a pandemic that will also change, I think, the face or the makeup of social work, and some of that may well be for the good, in terms of how we engage, and from a children and families perspective, the digital world has opened up a very different way that social workers are sometimes able to continue to engage with young people from their perspective. But it's the balance around that. But the time to be able to spend time with a young person and engage with them in a meaningful way is an ongoing challenge. And then I think there are some wider societal challenges that will have an impact on social work. I think that we have a number of inequalities currently. We have inequalities in terms of health across the country. We have inequalities in terms of poverty, and I think those things will have an impact on social work. And I think we have inequalities in terms of a diverse workforce at all levels of the profession. And I think that, again, those are both within adults and children's perspective. So on a general level, I think that the issues that challenge social work are often bigger than social work itself. So as an individual social worker, I'm focused on doing best by the children, the families, or the adults that I'm working with, but their lives are impacted on those macro things that I've described earlier, and we have to understand that, and we have to think about that in our interventions with families, with individuals, and with adults, because those bigger things like food hunger are going to have an impact on the intervention that I have. So if on that broader level those things are not understood within the kind of social work intervention, I think we're going to be constantly on the back foot with some of our families and some of the adults we might be working with.
That's great, thanks Sharon. And I think it leads really nicely into the question that we have for you, Farah, which is around caseloads. And so the question specifically was, whilst large caseloads continue to be hard to tackle, what can employers do to look after and retain their staff? And we've, retention's already come up quite a bit, so I'd love your thoughts on that as well.
Okay, yeah. I think it's fair to say that people don't enter social work for the money. People enter social work, it's a decision of the heart, it's a deliberate career choice. Either people are come with their own experiences of some adversity in life or hardship, or they want to they come from generations of care professions, they want to challenge injustice. So the value base of social work, I suppose people have those mainly before they enter the profession, and training as a social worker helps you understand more of that. So I do think employers have a responsibility to look at retention. Retention is key, and I think that pay, putting pay to one side, because we know pay across the country looks different. Pay scales look different regionally. There's probably some similarities, but people don't come into social work for pay. And although caseloads can vary, the number of families or children or how they're measured within authorities can vary. I think the support is what social workers highlight that they need most. And so social workers, where they feel that they connected to their leadership team, where they feel that they are listened to and heard, and actually that feedback that people provide via lots of different surveys that go out, that those are listened to, so views are listened to and taken on board. So in my experience through my career, I think that's been a key to staff retention, and I know that's been something quite significant for us in Leeds. I suppose, as social workers, as social work leaders, as social work practitioners, we talk about listening and we talk about taking on board feedback, and we can't shape services without listening to the people who we serve, and also the people on the ground who are working with families. And I think one thing that COVID in particular has taught us is that actually if we want to retain staff, retain experienced social workers, that we need to show flexibility. Employers need to show flexibility, and so I remember the days where working from home was seen as a lazy day, where somebody was taking time out, where maybe they just were catching up on a bit of admin, and there was a lot of taboo around taking working from home days or that flexibility. Well, as actually overnight the pandemic has pushed us in a way where mostly people are working from home, and I would hope that some of those flexibilities that people stop, pause and think and reflect and take forward, because we have people with children who would like more opportunity to drop their children off at school. There might be some distance involved in travelling to work. So I think looking at it from an environmental point of view, but also a flexibility point of view, we're going to retain more parents. We might retain more people who have a caring role, who are getting to an age where they might have caring responsibilities for parents as well as grandchildren. So we have to show, some employers have to show flexibility. I think it's fair to say that the impact of the pandemic and mental health and emotional well-being of workers, people working from home, kind of bringing the trauma, if you like, the all that, carrying all of that without being able to talk to teams or being in a team environment or leaving it at work has been hard. All of us are sat in our own living rooms, in our own bedrooms doing this, and that can have an emotional impact while there is some benefits. So looking at the emotional well-being of staff is quite key in staff retention, and acknowledging that social workers as a profession, we have been at the front line of responses in the pandemic, but well before, or poverty, the impact of that on the people we serve, and the experience of services and waiting lists, etc. Social workers don't have a waiting list. People need social work, and I'm speaking from children's social work background, but I'm sure the issues are exactly the same in adults. We don't have that choice or that privilege of being able to have waiting lists. So support for staff, I think, is quite key in retention, but it's not rocket science. Social work never has been, nor has social work leadership. It's about listening, engaging, and then taking feedback on board, and employers seeing this as real learning opportunities.
That's great. Thanks, Farah. Really comprehensive. And I just want to say, that huge things have happened in the last year, and we're not going to bypass them in this Q&A. We will be coming back to COVID, and there's some questions that are coming in that are really pertinent to it. And obviously, one of the other massive events of the last year was Black Lives Matter, and that's where our next question comes in. Back to you, Sharon, for how the sector can embed a culture of anti-racism for the future.
Thank you. Yeah. I think this is an interesting one because I think there are a number of layers to this. So for me, I think picking up on some of the points that Farah just made in terms of listening, I think that as a profession, we've spent the last few years, in my opinion, believing that we're anti-racist, that we're anti-oppressive. But actually, when we start to drill down and we start to look at individual experiences that colleagues are having, that's not always the case. And I think one of the key things about embedding a culture of anti-racism, anti-oppressive practice, anti-discriminatory practice is that employers need to be able to listen to the experiences and own those experiences that people are describing, and that we can't continue to just operate in silence. So for me as a Black worker, as a Black manager, a Black leader, I have my own experiences where I've talked about issues that have impacted on me, and I'm met with a silence. And I'm not saying that silence is always a negative silence. Often that's a silence of people being unsure what to do or being uncomfortable. And I think if we want to move beyond that, we're going to need to be able to have those conversations and have those conversations at different levels. And my challenge to leaders across the sector is that we also need to be able to have those conversations that are uncomfortable. So what Black Lives Matter has really illustrated in terms of the conversations that I've had, and also I think on a personal level, my own thoughts is that we can't remain silent. We actually need to talk about it. We need to call out the inequalities that might be around. We need to talk about the culture that the individual social workers are working in, and does that culture lend itself to exploring the wider issues? And what do we do when people are calling it out? Do we hide from that, or do we actually unpick that, and do we actually accept that if a member of staff has described a situation where they feel that they have experienced racism or discriminatory practice, that's understood and accepted, and that's not brushed away? And often people brush it away because they're unsure what to do, or they don't want to own that actually I'm working in an environment, and by being silent I'm complicit with that. So one of the things that Farah and I talk a lot about, and we talk about within the Principal Social Work Network, is allyships. You know, how do we as allies, as well as individuals who've experienced discrimination and oppressive experiences, have those conversations? And I think the challenge that is within the profession in terms of embedding a culture of anti-racism is to not just think about the person who's directly experiencing, but what about those people around them? So the colleague that witnessed it, the colleague that felt uncomfortable with the conversation, or the colleague who has sat and listened to another colleague talk about a difficult situation with an individual young person or an adult that they're working with, and they say nothing. So for me, the embedding it is to first of all be comfortable to have the conversations. And I guess the other thing that really I've been thinking a lot about in the last year is the values of social work, the values of social work in terms of addressing inequality, the values of social work about justice, social justice, and where we've kind of lost our way a little bit in terms of fighting, in inverted commas, racism. And if we are not able to have those conversations as colleagues, then how are we then supporting the individual families, the individual adults that we're working with, where they might be experiencing those institutional racist situations, or they're trying to navigate through a world where because of the colour of their skin, or because of other factors, they're not feeling that they're getting equal treatment, or their experiences are not felt to be as valued. So I don't know, Farah, if that's probably not part of the process, but I know just because we've had lots of conversations, I don't know if there's anything you wanted to add to this question.
Thank you, Sharon. Yes, you're right. We have, we've been talking about this, and I suppose reflecting on our own journeys, and continue to on our own journey on racism and how we use our roles to tackle it and raise awareness. And I think one of the things that we want to share is that actually the difference where there are organisations or teams, and there's some good practice going on where there is a difference, is that it's not left to the Black or the Asian or the minority worker to do the anti-racist work. So it's not, it's not highlighting that tackling racism is something that the person of colour has to challenge, and it's acknowledging, like Sharon says, that if you're being told or you're hearing that somebody's experienced racism or felt uncomfortable, it's not for you to question that, because I can tell you, week after week and day after day, and Sharon and I in this role, continue to, and that's why we're doing it together, because we support each other. So we continue to experience that of women of colour in particular. We continue to experience the behaviours that might not be outright racist and visible, but that actually do have racist tones. So things like over scrutiny, of our actions, the visibility being looked at through a negative lens, critiqued differently, challenges that are not there for somebody who is white and in our position, and it's uncomfortable. It's uncomfortable for the people hearing it, but I wish we had the privilege that we didn't have to talk about it, so we can't ignore it. And I think that the support that we've provided each other, but also from colleagues in the Principal Social Work Network, and that's why support is important, that we need to have these uncomfortable conversations to understand it. So I think that accepting that racism is there and it's all our responsibility, going back to the core values of social work, not diluting it with with kind of overall equality issues, because equality is something we all strive for in every area, but the colour of your skin is something you can't hide, so you take it wherever you go, and that's the first thing people see. And so the opinion they form will be based on that. So I think that that's why we wanted to name it as we want to name racism for what it is, but also anti-racist practice, and we're doing some joint work with Social Work England, the Principal Social Work Network, and the What Works in Children's Social Work, and to really unpick and look at how we support the next steps for anti-racist practice in social work. But there's no quick solution. We've got to carry on having the conversations and acknowledge that racism is there and it's live and it's still happening.
Wow, what a fantastically comprehensive answer to that question. Thank you both, and really thanks for sharing your personal experiences and also for such pragmatic responses. It's really heartening to hear, and I feel like I've got some new tools already, so thank you. Just before we come to the questions that are coming in through the live session, I'm going to ask one last one to Kamlesh, and this came in from Rita in Redditch, and so the question was, currently social work and social care is not recognised in a meaningful way by the government. What is happening to ensure that social work and social care is on the agenda of national government? Kamlesh.
Right, a nice easy question there then for me, Rita, thank you. I'll probably try and give a short answer to this. I think there's two separate questions there. I think the recognition of social work in a meaningful way by government, and then the whole issue of social care. I think in respect of social work, I think the short answer is the government is doing a lot, and I'll come back and explain very quickly what that is. If I take social care first, I think that's probably got a bit of a longer way to go. We began focusing on this area through the Care Act. It put it on the agenda, but I think for many years the discussion around social care has been about the cost of residential care, as opposed to the broader aspects of the care agenda and working with vulnerable people. A whole broader agenda that can be met by social care that would actually save money in the long run in terms of chronic health problems. I think the new white paper will present some opportunities for social care. The whole idea of integrated care systems and bringing social care into the frame is important. I believe the government are introducing a new role for the Care Quality Commission, the Health Inspectorate, to assess whether local authorities are meeting their social care duties. So, the government's taken a regulatory approach to this. Is that a good idea? Will it improve things? Is it passing the buck? All to be seen. I would probably argue that if it's done well, it could be a good beginning and put a spotlight on the issue. Like the pandemic's shone a very clear spotlight on this area. I believe the Secretary of State will have specific powers to direct funds to social care providers when it's not being met. So heading in the right direction. Of course, we've had the Department of Health being called the Department of Health and Social Care. It's been there for a while and it needs to do a lot more. The argument is the pandemic and maybe other things have taken over, but it's still there. Of course, we need to see a social care white paper on this. So in terms of social care, short answer, some movement, long way to go. There's some baby steps, and I think everybody's acknowledged that major change is needed. And maybe the new white paper, the creation of the integrated care systems may help with that. In terms of social work, I'd be more optimistic. I would suggest probably quite a lot's been done. If we go back prior to the pandemic, which seems a long time ago, we had two government departments, the Department of Health and Social Care, the Department for Education, putting together a fairly comprehensive programme of social work reform to support and enable social workers. Lots of different commitments about continued professional development. I think the consistency of support to newly qualified social workers through the AYSE programme, funding for social education in the future, and of course the biggest issue, a dedicated social work regulator with a real focus on improving the quality of education, training and practice. And that's all happened. We're one of the few professions that have got a chief social worker in the Department of Education and in the Department of Health and Social Care. And Sharon mentioned it, we have a care review happening. We've got appointments to safeguarding boards regionally and nationally. We've got new appointments to special guardianship and adoption boards. So a lot is happening in this space. So I think we're on the agenda. Obviously, Social Work England has a really important part to play to make sure that we deliver on all those issues and that both departments keep this on the agenda. We have a lot of policy issues about making the Department of Health and the Department of Education meet on policy and practice terms. But I think it's a positive story in respect to social work, and it's a longer journey in terms of social care.
That's great, thanks Kamlesh. So we're going to come to the questions now from the session, and we just want to say before we go to that apologies, we were hoping that Mark Harvey, Chief Social Worker for Adults, would be able to join us today as well, but we've had technical problems with that. He is here, he's viewing, yeah, I'm sure he says apologies that he can't be here and he can't take any questions, and we'd love to pose this one to him as well. So instead I'm going to pose it to Colum and go from there, and if anyone else wants to answer it as well. But this is a great question that came in. It's 2023, so they're really taking the future of social work vision seriously, which is lovely to see. What are some of the main social work learning curves working in the older adult sector following COVID-19? Do you want to have a crack at it, Colum?
I'll certainly try, Marina. This is when I'm really sorry Mark's not here. And Mark, if you're listening, I apologize if I get this all wrong. But I mean, and hopefully others, I'm very happy for you to come in on this. But it's a very, very important question. And I'm not sure the 2023 is future long term. I think it's relatively short term in this context. But I do think there's an opportunity coming out of the pandemic for social work and social care, and I'll focus on social work to think about how, in many ways, it could be repositioned. So much of older people services, older adult services has got a kind of focus in and around health. So it's only kind of talked about in the context of health, and I think that's come through a little bit in the pandemic as well, in terms of the kind of health needs, and certainly I think it's really important that social, you hear people kind of refer to, and this is important, but you hear people referring to, the role of social work, for example, around the throughput of people through hospitals. And I've referred to people who are unable to move for hospital for whatever reason as bed blockers, or so it's all in the context of service delivery. Whereas I think it's really important that we shift that concept of social care in its broadest context, in that it is about the social needs of people and how they live in their community, and that's it. There is a broad range of services and a broad range of supports, including all sorts of supports that aren't services at all, but are about how people are engaging in the community around them, and that's the crucial role for social work in that. So I think there's an opportunity for us to explore this further. I don't think the discussions around practice in social work in this way have been kind of robust enough, and I think if we're going to take something out of the pandemic, then I think there's learning in this. I mean, Kamlesh earlier talked about integrated care systems and the white paper, and the opportunity for integrated care systems, and that's about understanding the system within which people live, and no one is better placed to be able to do that than social workers, to understand the overall context and systems within people work and how they can be responded to. And they are the sum of all their parts, and not just a part of a diagnosis or some other part of who they are. So this is crucial, and I think it's really important that we don't reduce as well discussions about social care to cost and to funding and how it can be funded. So I think social work is a really important role to play in what I believe to be a very important national conversation over the next couple of years, and that we will have learning curves that will help us develop approaches to practice in this area. And certainly in terms of Social Work England, that's very much, I go back to the holding the mirror, that's very much about how this organisation can work with people in a collaborative way to ensure that some of those key questions are asked and help to be answered. And of course, that's an important part of education and training in social work, but also a fundamental part of post-qualifying and post-qualifying framework and ongoing development and practice. Someone talked earlier, there was a note in the text earlier about how to develop a career that is not just about into management, but actually a career that is bringing greater depth to practice and expertise and specialism. So let's look at that, and let's see where these areas of specialisms are required, where they are needed, and where there is greater need to develop practice. And let's see if we can develop a framework that supports that specialist approach, that people can stay in practice, be that in older adult services and the key areas that impact on that, or in children's services, or working in particular areas. I think we'd all like to be able to support that, and it's important that we work with employers and others that they can see the importance of that type of career progression as well, because I actually think that will help with retention. and it's really important that we use that as a way of helping and encouraging people to be able to gain greater expertise and stay in practice and bring their knowledge, experience and skills over years to that. And I think that's one of the key areas as well that will help the learning process with this as well. So I know that's a broad kind of response, but as I say, if Mark was here, I know he'd give a more detailed response.
Yeah, that's great. Thanks, Colin. Sharon, did you want to come in still?
Yes, I did. So again, thinking a little bit broader than just one thing. Something that struck me as Colin was talking was that actually that move away from just thinking about the health dimension for older people or for anyone, and actually thinking family. So what the pandemic has shown us is, or reminded us or illustrated to us, is that how important family and family relationships are, and the impact of those families. So for colleagues who have experienced bereavement of relatives, that has an impact on whether you're working in children, whether you're working with adults. I think that there are, as someone who trained as a generic social worker and then went into a specialism of children and families, there was some value about understanding the different issues that may affect different people, and how do I connect with that in the assessments I'm doing in relation to children and families, but there may well be an older relative as part of that network, or there may be adults with mental health. Do I understand those connections and the impact that has on the child and the relationship with the child, and vice versa? So I think going forward for us, one of the potential strengths we have as a profession is that connectivity, and maybe there is something about revisiting the processes by which people become specialists at a training and education level, and reconnecting that kind of wider generic thinking about how we understand individuals within family context, individuals within the wider community, the wider systems that they're part of. So that just struck me that the pandemic may take us back to some of those ideals that we had been exploring in the profession a few years ago, where certainly in a safeguarding context, I can recall that actually thinking about when we're looking at safeguarding processes, that you're also looking at the wider connections and the wider context for an individual child or an individual adult. So I just wanted to add that to the consideration. So it's a bit broader than the original question, so apologies.
No, that's fine. Thanks ever so much. So I'll move us on to another one. Farry, you said you were willing to have some thoughts on this one. So I'm a new entrant to the sector after a 20-year career in the private sector, and I see a huge opportunity for technology to help frontline social workers. What do you think about what is being done in this area?
So actually, this is a kind of, I've been on my own journey with technology, so it's quite an exciting one, and one that I think that we need to be open-minded to. So even us doing this, nearly 400 people, and as a panel joining from across the country, is only possible because of technology, which a couple of years ago we wouldn't even considered. We do need to be open-minded moving forward. Learning from the private sector is key. So I myself look at organizations, kind of companies like Airbnb, for example, and how they target their marketing and how they recruit, and how clever private sector are in the kind of the profit making huge corporations, and how they operate in using data. So I think that we can use data more smartly. I think that we don't often, we have data sets that produce reports in social work, and each authority uses their own different kind of electronic system, if you like, recording system, but reports often sit as a way of compliance, and humanizing data is the next steps in social work, how we drive that, and how we drive that in social work learning through ASYEs, through their journey, so that actually behind each number there's a person person, and the data is telling us what we need to do better. That is very different to predictive analysis and using data to target people or to label people, and that's something we need to be quite aware of. So what we don't want, I suppose, in similar, comes with a warning flag similar to ACEs, is that we don't want to label people and make predictions for people based on certain data information. So maybe where they live or which school they go to or what their parents did, etc. You know, we don't want those to become labeling, which they can easily do in machine learning. So we need to be careful that we steer away from that. But using technology for meeting, for conferences, to understand the people we serve, to understand risk, for example, in child exploitation, you know, overlapping different data sets and data from the police, from health colleagues, from the local authority, to understand children, young people, adults that are at risk, and people that target them is quite key. And I think we're learning about those all the time. I know there's lots of research projects going on as well that people can get involved in nationally. So, you know, I think we are, you know, there is a lot of work to be done, but I suppose this journey in the pandemic has accelerated social work by about 10 years. So I think people are getting used to putting their pen and paper down. I think that's really good for the environment as well. I think that we're not all getting together in Sheffield or in London or wherever and spending hundreds, and the planet, you know, our carbon footprint on travelling to one place for events like this is actually going to have a huge environmental benefit as well. So yeah, exciting times ahead.
That's great, thank you. And Kamlesh, you wanted to pick up on this?
I was going to come in on it, but Farah covered just about everything I wanted to say. I mean, far more eloquently than I could have done. I suppose just, you know, I mean, my experience outside of social work in other sectors, certainly the health sector, you know, it's 10 years work in 6 months. There's no question about it. And it's here to stay forever. And I think, you know, the whole issue of early diagnosis, wearables, you know, but it's about data capture, good data analysis, and how we use it properly. There's a lot of ethical issues around that, but you know, I think the private sector and the health sector are rushing down this road now, and we probably won't go back to normal. And I think we just need to embrace the idea that technology is a tool, it's how we use it. I mean, you're never going to replace sitting in front of somebody and talking to them when there's a difficult time. I mean, you know, hopefully AI is not going to replace a good quality social worker, but the tools are valuable. We can use them in different ways. You know, we've done it through the pandemic, and I think it's going to be a real asset that we should open our eyes and hearts to.
That's great, thank you. So possibly coming to our last question now, which just feels like it's flown by, and I know there's so many questions coming in, but this one was from Helen, who's clearly studied our documents, because it says in the Social Work England consultation report 2019, it highlighted that co-production should be integrated in social work education. Why is there no mention then of co-production in the Education and Training Standards 2021? Colum, that's definitely your bag.
Thank you, and happy to pick that up. Co-production is really a real central component of the organisation. I mean, we put together a strategy for the next number of years, and you know, there were 5 pieces in it, and you know, one of those pieces is about co-production and engagement for us as an organisation. I believe it's absolutely fundamental to social work as well as we go forward in terms of how and what the values and principles that underpin people's work is about. So I'll revisit that around the standards, but one of the piece of work that we're doing with the standards at the minute with our education advisory forum is developing learning outcomes, professional learning outcomes. So being able to really articulate what it is we anticipate that social work students should be learning, and what the outcomes should be for that learning through the stages of their development, and to the end of their qualifying period. So we will certainly look at that piece of work, and I'll certainly ensure that piece of work has co-production at its heart in terms of both the input into training and education, but also as an outcome for people. Because in the end, you know, how can we really expect people to really grasp and understand and be able to work in a way that is informed by co-production if we're not doing it in education and training at the very start? So that has to be part of it, and it has to be part of their experience, and it is a challenge. And it is a challenge we will lay down before the 83 different institutions that we regulate in terms of social work programs, and how they show that and how they evidence that there is co-production at the heart of the work that they're doing. So that will be very much part of what we're doing, and we will be very keen as we launch our new reapproval process now in September. Over the next number of years, we will be reapproving every single course across England. This will be a major part of it, and we'll be very happy to report on it as well.
Yeah, I think Kamlesh wants to just come in here too.
Just very quickly, and people have probably heard me talk about this, but you know, when I took over as chair and we were designing the vision for this, there were 3 key elements that we were absolutely wedded to, and that was, you know, collaboration, engagement, and co-production. And I just want to make a point about co-production. You know, we use this word quite glibly, you know, and what does co-production actually mean? Does it mean I'll write a strategy and then I'll tell you about it? Does it mean I'll write a strategy and then I'll consult about it? You know, does it mean I'll write a strategy and I might ask you what you think about it and make some changes? Or does it really mean we'll produce something together? Now, the ideal scenario is we'd love to produce absolutely something together. And that's why we've got the National Advisory Forum, and that's why we've got the education training. But it's difficult. It is not easy. So I think we have to just be careful about that, but absolutely, you know, do we want to co-produce? Yes, we do, and we'll attempt every innovative way possible to do it.
Thanks, Kamlesh, man after my own heart, on the co-production front. I'm really aware that we've had so many questions come flooding in. Thank you so much for fully participating and sending them in, and we would never going to get to all of them, so what I really want to encourage is we have a whole team of regional engagement leads who are staffing this whole week, and Matthew will add the link to our webpage for that. They are there for you to ask questions of, so please do get in touch with your local regional engagement lead and keep these questions coming. Just as Kamlesh has articulated, that is what we want to do at Social Work England. We want to hear from you, we want to collaborate, yeah, and so please do get in touch. So as I mentioned at the beginning, Laura from Nifty Fox has been with us today illustrating this session, and I just want to hand over to her now to share her screen with us and show us what she's done.
Hi everyone, great to be with you. This is the bit where I get a bit squirmy because I'm hoping that the technology doesn't fall over. Can we all see that? Can I just get a nod of head? Can we see my screen okay? Perfect. So what I'm going to do is I'm going to walk you through this because there's quite a lot going on. So I thought I'd take you on a journey. So I'm going to turn off my view slightly so you can see the back end. But what I've done is everything in the light green was a question. And so I've tried to capture some of the key points from each of our speakers. So if we go to Colum first, we started with this idea of how can we increase the numbers of social workers that are being employed and that are being drawn to social work. And this key challenge here was about showing the value of social workers in a high profile way, and how can we inspire people to get involved, but also instill a sense of pride through collaboration with our social workers that are around us already and are doing a great job already. And then a bit later in the discussion, Colin commented on social work in the pandemic and what can we learn from it. So it's focusing on the breadth of services that social work encompasses, because there was this health focus, but it's so much more than that. And actually social work is a sum of its parts, and how can we show how it works together as a system to improve living and life in the community. We also then at the end here touched on co-production, and we talked about how we're embedding co-production into the learning outcomes of the training for social workers, both as an input and an outcome, and also evidencing co-production throughout your work too. Then Kamlesh talked about how do we get social work on the government agenda. He talked a lot about social care has a way to go, but our white paper that's coming up will help kind of raise that profile slightly. But with social work, we're more optimistic too about funding, training and new appointments to drive this agenda. He also made some wonderful comments about co-production too, but I ran out of room, Kamlesh, so unfortunately you were victim of my smaller page, but I recognise that you were talking about co-production as the heart of everything you're trying to do, and also recognising, especially with technology, how we can learn from the private sector about how to use data effectively and humanise data. And then Farah was talking about reducing caseloads and understanding that social work is a vocation, and so people aren't really in it for the money. But despite that, we need to focus on retention, offering ongoing support and also flexibility in our roles to ensure that those caseloads feel more manageable, so people have different ways of approaching them. And as part of that is thinking about managing emotional well-being. And I really liked what you said about we need to listen, engage and respond, so that again it's kind of co-producing this support process too. We then touched briefly on technology at the end, and you talked about learning from the private sector, in particular about data use and humanising data, but not only that, around recruitment, engaging with the environment more sustainably, and also engaging with audiences differently through different media and thinking about how you can access the community in different ways. And then with Sharon, we were looking at what's the biggest challenge for social workers, and you talked about retention, motivation and training, and also time for meaningful engagement with the people that you serve. But underpinning all of it is these systemic issues, so poverty, racism, different kinds of food poverty and things like that. So actually there's so much more that within social work we can't solve that we need to be aware of. We then looked a little bit about embedding anti-racism within the social work practice, and this links to the presentation we had yesterday from Prospera, which is about listening to and owning those experiences. And I really liked what you said, Sharon, about removing the silence, giving people the space and validation to share that experience, but also improving allyship, because some white colleagues might be quiet because they're not comfortable or sure of how to react to these situations. And actually at the heart of it is returning to the values of social work, which are in and of themselves anti-racist and anti-discriminatory. We also looked a little bit about the pandemic impact with Sharon too, and she highlighted that family relationships are crucial, and understanding this connectivity when working with the community is so central to ensuring that we can repair those relationships and mitigate the impact of the pandemic. And even though Mark couldn't join us, I wanted to make sure he had part of the picture too. So Mark, hello, and I'm really sorry that you didn't get a chance to speak, but you're still here and we still love you. So that in a nutshell is what you've experienced today, but thank you so much for having me. It's been an absolute pleasure.
Yeah, that's amazing. Thanks, Laura. And absolutely, we Jack, I don't know if you're with me. Yeah, thank you. I'm always a relief when Laura summarises the session for us and we see what amazing content there was, and it's captured forever, so thank you so much. That was brilliant. Round of applause you got there from the panel here. So we'll just ask you to complete our survey for this event that Matthew will have posted in the Q&A, just to get your feedback on that. Any other feedback to Social Work Week at socialworkengland.org.uk. It's been a pleasure to be with you today. Thanks again to the panel for their time, thoughtful answers. It's just been a privilege to be with you. So please enjoy the rest of the week. There are still tickets available, particularly for the keynotes and networking lunches. So come along to those and meet your regional engagement lead. And we look forward to 3 more days of this. So yeah, lovely to be with you all. Thanks ever so much.